Infertility by Annabelle, Fabiola, Monica, Dana, Diego, and Rosie.
Infertility is defined as the inability to conceive children. 10 to 15% of couples in the US are infertile, and these couples are 3 times more likely to get divorced. The cause of infertility may be difficult to determine, but may include inadequate levels of certain hormones in both men and women, and trouble with ovulation in women. The main symptom of infertility is the inability to get pregnant. There may be no other obvious symptoms, but sometimes an infertile woman may have irregular or absent periods. Rarely, an infertile man may have some signs of hormonal problems such as changes in hair growth or sexual function. Many treatments significantly improve the chances of getting pregnant. They include hormone treatments, fertility drugs, and surgery. In addition, assisted reproduction uses various medical techniques to fertilize an egg. For couples who experience fertility problems and those who wish to have children at an older age, there are more options available than ever before. As new technology becomes available, fertility treatment is now accessible to more people, and success rates and safety are improving all the time.
Infertility is definitely a topic of interest and something everyone should be aware about because it can affect literally anyone. 10% of women in the United States aged 15 to 44 have difficulty getting or staying pregnant. 7% of men are infertile. It is important to know if you'll be able to have babies so you can prepare with your spouse and explore other options. Infertility is a big cause of divorce among couples. Many people can't stand the thought of not being able to have children with their spouse. While there is no way to prevent infertility, there are some ways to boost fertility. Keeping a normal BMI, limiting alcohol and caffeine can have an impact. Keeping a well-balanced diet and a good health overall may help boost fertility in an individual.
Infertility is a common problem that when it is thought about, it is mostly associated with women. While this is true, it also is found within men. Since it is starting to be more recognized and more of our society is being affected by this, it is important to know the risks, treatments, and what we currently know. For men, infertility comes from varicocele, when the veins in the scrotum are too large, which increases the heat, affecting the number and shape of the sperm. For women in their 20s, they are more likely to get pregnant, yet up to 25% of women within their 20s will not get pregnant. If women notice they have irregular periods, they should contact their doctor. When women reach their 30s, fertility begins to decline. Women in their 40s have a 5% chance of getting pregnant because of their obstetrical risk increases. The treatments for women in their 20s, 30s, 40s all consist of either oral medications and intrauterine inseminations. For women in their 40s, they also have the option of egg donations.
Controversies for infertility. Men and women who are infertile look for the best course of treatment. However, many of the best treatments come with great risk, making it an issue with many controversies. For women, a risk from infertility medication can be getting ovarian hyperstimulation syndrome. This is a critical reaction to infertility drugs that can cause kidney failure, ovarian torsions, and can even lead to miscarriages. Men who are infertile seek to get surgery for varicocele repairs. However, if the surgery is not successful, it could lead to varicocele recurrence, which can cause more problems with fertility rather than fixing it. The risk for getting infertility treatments can be very dangerous for both men and women if the body decides to reject any treatments or medication.
Where things are going to help fertility. For men, there are 3 options: surgery, antibiotics, and hormone treatments. Surgery can be used if the scrotum has widening veins that cause blockage in the vas deferens. Antibiotics can be used to treat infections, and hormone treatments can be used if the male has high or low levels of hormones. In women, there are 2 options: surgery, infertility, and hormonal drugs. Surgery can be used to remove tissues that is blocking fertility or to open the fallopian tubes. Fertility drugs and hormones will help the woman ovulate or restore levels of hormones. Infertility can also be treated with assisted technology, like intrauterine insemination, in which sperm is collected and placed directly inside the woman's uterus while she's ovulating. Another option is vitro fertilization, where the sperm and egg are collected and brought together in a lab. The fertilized egg then grows for 3 to 5 days, then the embryo is placed in the woman's uterus. And lastly, the gamete intrafallopian transfer can assist with infertility by collecting the sperm and the egg and quickly placed into the fallopian tube.
In recap, 10 to 15% of the population in the United States are infertile, so infertility in the United States is common. There are many treatments that increase the chance of getting pregnant, such as hormone treatments, fertility drugs, and surgery. In addition, there are many laboratory and medical treatments to increase the chance of pregnancy. Infertility is common in both males and females, so infertile men are no less than infertile women, and infertile women are no less than infertile men. A natural way for men and females to boost fertility are to maintain a normal body mass index, limit caffeine and alcohol, and maintain a good, healthy lifestyle. Most men become infertile due to varicocele. Varicocele is when veins are too large that it increases the heat, affecting the number and shape of sperm. One of the most affecting factors of infertility is age. Most couples have the highest chance of getting pregnant in their 20s. After the age of 35, fertility declines in couples by 50%. From the age of 35 and 40, fertility is potential but not a danger zone during this time. And at the age of 40, couples have a 5% chance of getting pregnant. By this age, couples have the highest chance of miscarriage, hypertension, and delivery complications. As technology starts being used more and more in medicine and in laboratories, fertility treatments are more accessible to people, and success rates and safety are improving. Thank you for watching.